In this episode, we will address something that few specialists talk about on a daily basis. Yet, for many patients, this is the most painful, invisible, and at the same time, one of the most destructive symptoms of ADHD. This phenomenon is called Rejection Sensitive Dysphoria, RSD, that is dysphoria related to sensitivity to rejection or extreme sensitivity to perceived rejection. But let me explain, this is not just a strong feeling of rejection. It is often a catastrophic emotional reaction that can destroy relationships, careers, and self-esteem. Let's start with a definition. Rejection-sensitive dysphoria is a term describing an extremely intense, immediate emotional reaction to real or perceived rejection, criticism, negative evaluation, or disappointment. I want to emphasize that RSD is not a formal diagnosis in DSM-5 or ICD-11, but it is a clinical phenomenon most often discussed in the context of borderline personality disorder and ADHD. People with RSD often describe their experience with phrases such as, "I feel as if I've been physically hurt. It feels like I've been rejected forever. This feeling doesn't go away." This is because when such reaction is triggered, it is very difficult to function, to think clearly, or to focus on anything else. And the emotional pain is very hard to extinguish. It simply lingers. These reactions are disproportionate to the situation, but for a person with ADHD, they are still real and deeply emotionally painful. Why do people with ADHD react so strongly to rejection and criticism? RSD is a manifestation of emotional dysregulation, difficulty controlling and modulating intense emotions. Unfortunately, this is still not a formal diagnostic criterion of ADHD, yet, in my opinion, it is one of the most important core elements of the disorder. In people with ADHD, mesolimbic pathway, which among other things is involved in emotional regulation, functions differently. Dopamine levels, which normally dampen excessive emotional reactions, are reduced. This may cause rejection to be experienced as a real, long-lasting threat rather than ordinary social information. In everyday clinical practice, RSD, as one of the phases of emotional dysregulation, manifests in several very characteristic ways. Sudden dramatic drops in mood after minor criticism, even if the comment was not intentionally malicious or negative. Interpreting rejection as a personal failure, often without the ability to rationalize it. Repetitive thoughts such as, "What did I do wrong?" or "What do people think about me?" even long after the situation has passed. Importantly, people with RSD do not choose these reactions consciously, even if people around them think they could easily stop the feeling. Think about it. No one wants to be overwhelmed by emotions that can potentially lead to self-harm or suicidal behavior. RSD is therefore a neurological reaction, not a weakness of character. But RSD is something more, something deeper than ordinary sensitivity. Normal sensitivity may mean feeling sad for a few hours after negative feedback. In RSD, emotions are immediate, extreme, and may last for days or even weeks, even when the trigger was minor. Moreover, people with RSD often perceive rejection where none exists. For example, no quick reply to an email, no text message or phone call from a loved one who is on a business trip, a casual remark from a friend, a routine opinion at work. All of these may be experienced as emotional catastrophe. Many manifestations of RSD are not recognized by professionals as RSD, but instead misinterpreted as anxiety OCD, or even delusional thinking. For example, some children with RSD insist for years on sleeping in their parents' bed or repeatedly come in the evening to check whether their parents are in their room, whether they are asleep, whether nothing has happened to them. One of my adolescent patients repeatedly checked whether the rug in her parents' bedroom was straight because they might trip and hurt themselves. She also repeatedly checked many other potential dangers threatening her parents. RSD may also manifest in attitudes such as avoiding social situations that may involve criticism, excessive people-pleasing and over-adaptation, constant seeking of validation, emotional distancing to avoid letting anyone get too close and risk unbearable abandonment, or, on the contrary, excessive emotional dependence on another person. Avoiding pursuing goals out of fear of failure. For example, a person walking to a bus stop who sees an approaching bus will often slow down rather than run up, even if the bus is clearly within easy reach. This very often leads to relationship problems, chronic anxiety, low self-esteem, social isolation. As I mentioned, RSD is often misdiagnosed as depression, anxiety, OCD, borderline personality disorder, mood disorders. Why? Because symptoms are intense, emotions are extreme, and reactions appear dramatic. The key difference is that in RSD, the reaction appears suddenly and directly after perceiving something as negative, is much stronger than expected for the situation, and lasts a long time, being difficult to replace with another emotional state. Because RSD is not a formal disorder, it is difficult to conduct large-scale research on management methods. However, I would like to outline several approaches that are clinically useful. The first one, psychoeducation. Understanding the reaction and accepting this is how my nervous system works. Recognizing that it's a neurological reaction, not a personal flaw. Cognitive behavioral therapy, which offers techniques to interrupt cycles of negative thinking. Dialectical behavior therapy, DBT, which offers structured emotional regulation strategies, mindfulness, breathing training, cognitive distancing. If you want, I can make a separate video on this subject because this is a major subject. Social support and communication, explaining to close ones what you feel and how you react and why. And finally, pharmacological treatment of ADHD. Treating the underlying ADHD often reduces the severity of RSD. A meta-analysis from 2 years ago showed that in patients with borderline personality disorder, where RSD is very strong, only ADHD medications, stimulants, reduced emotional dysregulation manifested as self-harm or suicidal behaviors. The most important conclusion I want to leave you with today is RSD is not a weakness of character. It is a deep emotional hypersensitivity, which in ADHD can become one of the most difficult elements of everyday life. Understanding RSD is the first step toward emotional health and better relationships. If this video was helpful, please leave a comment and share your experience with RSD and ADHD. How does it manifest in your case? If you want more clinical, practice-based ADHD content, please subscribe to the channel and see you in the next one.